Hi everyone, welcome to Pharmacology. So in today's video, we are going to discuss about human teratogenic drugs. So as you all know, a teratogenic drug is any medication or substance that can disrupt embryonic or fetal development, potentially causing structural birth defects, growth restriction, or functional abnormalities. Teratogenic exposure is most critical during the first trimester when major organ formation occurs. Some of the most widely documented teratogens require strict avoidance or medical supervision during pregnancy. Historically, the US FDA, that is US Food and Drug Administration, used a letter system that is A, B, C, D, and X to categorize the teratogenic risk of medications. So, in today's video, we will see some common human teratogenic drugs and the abnormalities they cause. So the first one is thalidomide. It can cause phocomelia and multiple defects. Then anti-cancer drugs such as methotrexate can cause cleft palate, hydrocephalus, multiple defects, and even fetal death. Androgens can cause virilization, then limp, esophageal, and cardiac defects. Progestin can lead to virilization of female fetus. Stilbestrol can cause vaginal carcinoma in teenage female offspring. Tetracyclines can lead to discolored and deformed teeth, then retarded bone growth. Warfarin, which is an oral anticoagulant, can cause depressed nose, eye and hand defects, growth retardation. Phenytoin, which is an anti-epileptic drug, can cause hypoplastic phalanges, cleft lip or palate, microcephaly. Phenobarbital, which is a barbiturate, can cause various malformations in the fetus. Carbamazepine can cause neural tube defects and other abnormalities. Valproate sodium can cause spina bifida and other neural tube defects. Alcohol can lead to the development of low IQ baby, growth retardation, and fetal alcohol syndrome. ACE inhibitors can cause hypoplasia of organs, growth retardation, and even fetal loss. Lithium can cause fetal goiter, cardiac, and other abnormalities. Antithyroid drugs can cause fetal goiter and hypothyroidism. Indomethacin and aspirin can cause premature closure of ductus arteriosus. Isotretinoin can cause craniofacial, heart, and CNS effects. So I hope this video is useful for everyone. So thank you for your support. Please don't forget to like, share, and subscribe. Have a pleasant day.